2, 3.
Good afternoon. This is Jim Shames. I'm the health officer for Jackson County. And we're going to talk today about social distancing, and I also want to bring you all up to date on sort of what the situation is locally and worldwide. So the update on the number of cases of coronavirus, we have about 132,000 around the world, almost 5,000 fatalities. In the United States, there are 1,626 tested cases and 41 known fatalities. We have 30 in Oregon, no fatalities, and 2 in Jackson County and no fatalities. I think you need to understand those numbers represent people who have been tested. And as you know, we don't have enough testing capability, so we strongly suspect the actual numbers to be much higher than that. So we're going to be talking about social distancing. In order to do that, I'd like to provide you with some basic information to understand how we at Public Health evaluate the seriousness of a disease. And the first is a concept we call R0, and that represents how infectious any particular virus might be. So for example, the question would be, if I'm infectious, how many people am I likely to get ill before the infection has passed through me? And that would be the R0. An example, seasonal influenza represents 1.5 to 2 in terms of infectivity. COVID-19 appears to be somewhere around 2 to 3 in terms of infectivity, and measles would be an example of the extreme at 18. The second thing to measure is the lethality, how many people are likely to die from a disease. And for seasonal influenza, it's about 1 in 1,000. That would be 0.1%. For the great flu pandemic of 1918, it was somewhere between 1 to 2%. And for this disease, if you look worldwide and you look at different countries, in South Korea it's 0.7%. In Italy, it looks like it's about 5%. So significantly higher fatality for what we now know about coronavirus, the COVID-19 virus, than something that's similar in terms of symptomatology like the flu. So if you're wondering why we're taking this so seriously and why some of the measures that are being taken, it's because of how serious we think this disease is and how likely it is to continue to spread. So we've talked about how contagious this is and how likely it is to pick it up from inanimate surfaces. There's been some recent data which is a little bit in conflict with what I've told you in the past. It looks like it may stay on surfaces and be viable for longer periods than I had thought. So I think you should assume that inanimate objects could be contagious for up to days. Likely it's a matter of hours. It really varies depending on where it's landing, if it's metal or it's plastic or it's porous or it's non-porous. So cleaning surfaces is important. The other thing we're going to be talking about has to do with kids and how kids play into the contagiousness of this infection. And the basics here to know is that it looks like everyone in our community is susceptible, but some people get much more seriously ill than others. Children do quite well with this disease, and fatality is almost unknown in children under the age of 10, for example, whereas the fatality for older individuals is quite significant for those over 60 and certainly for those who are more elderly than that. It looks as if children can in fact be vectors and carry the disease to those more susceptible, even though they don't get terribly sick themselves. So I want to talk a bit about social distancing and describe what it is. So examples would be to make sure that you stay 3 to 6 feet apart from others when you're in a social gathering, avoiding shaking hands, and we certainly talked about how you should stay home if you're sick, coughing into the crook of your shoulder or into a tissue and throw it away, washing your hands repeatedly and carefully, You know, you probably know that the governor has both declared a state of emergency and now has an executive order around mass gatherings. And some of those characteristics are canceling all large meetings, those over 250 people, recommending that people over the age of 60 limit attending social gatherings that include more than 10 people, social distancing in the workplace. There are various recommendations for childcare, and avoiding non-essential gatherings for school activities, and that schools will be closed starting March 16th with the prospective start back date of April 1st, I believe. So with school closing, we recognize that that's a significant hardship, and also that the children may end up in the care of those that are elderly. And we would encourage everybody to give some thought as to how you're going to do the child care to avoid putting those who are at greatest risk at risk of getting the infection. So here's other things that you all should think about. Remember who's at risk, and do your best to protect those who have chronic diseases and those who are elderly. Probably a good idea to just go through the list one more time, which is wash your hands thoroughly, cover your cough, don't go out into public if you're ill. If you're quite ill and you think you need to be seen, to call ahead your healthcare provider to get a sense of where you should go and how you can show up in a way that you don't put the healthcare community at risk. We still have diminished ability for testing, but we are working on a community-wide level to set up testing opportunities, testing stations, and to have an adequate number of testing material. So stay in tune. We will do our best to get that information out, and hopefully your healthcare providers will know when those opportunities are fully effective. And go to respected sources of information, the Oregon Health Authority, the CDC, Jackson County's health site, the World Health Organization. There's a lot of false information out there, and we want to make sure that you know where to go to get reputable information. So I'm going to turn it over to you for the school perspective. Thank you.
Thank you, Dr. Shames. I'm Brett Champion. I'm the Superintendent of Schools for the Medford School District. And before I begin a few remarks, I want to thank Dr. Shames and his staff, Tanya and Jackson, for their excellent partnership with us in the schools at this difficult time. Thank you for all of your leadership in this area. As you know, the Governor of Oregon declared all K-12 schools closed beginning this upcoming Monday, and that schools are to remain closed through March 31st. The Medford School District is abiding by this rule. We are a believer in ensuring that all are learning, and learning is for all, and we're seeing this as a learning opportunity. It's actually an opportunity to do things like Dr. Shames just mentioned, such as continue our deep cleaning of our schools. Our staff has done a terrific job of keeping our schools safe for our students and for our families. This gives us another opportunity to go a level deeper in our cleaning, so we'll be beginning that work on Monday. As Dr. Shames mentioned, this is a challenging decision for our families, and so we in the Medford School District are committed to ensuring that we minimize the challenge for our families in as many ways as we can. Some of those ways include feeding for our students. We know that there are a number of our students who rely on the schools to ensure that they get meals during the day. We are committed to continue to provide those meals. We are currently working with Sodexo, our meal provider. We're reaching out to some other community partners, including the Maslow Project and Access, talking about how can we be hubs in our community for feeding of our students, a lot of whom are our most at-risk students. So more information will be forthcoming on that. We also know that childcare will be a challenge. Unfortunately, at this time, it's unclear what closing the schools means from the state of Oregon. And so we're awaiting guidance from the Oregon Department of Education to understand if our buildings can be opened for child care providers. If they can, we have child care providers who are ready to go to provide some of those services for our families. Again, unfortunately, we don't know what exactly schools are closed means in that regard. Our terrific staff in the Medford School District has done incredible work, and they continue to do so. They've reached out and asked how they can volunteer and help out with our schools that are being shut down on Monday. At this point, schools will be completely closed. They won't be answering phones. There won't be folks in those buildings, allowing us the opportunity to do the deep cleaning. District offices will be open next week. The week after that is spring break. And so we will be on a spring break schedule during that time. Then there'll be 2 days, March 30th and March 31st, where our school staff will be back, and they will be planning for our students who will return April 1st is the current plan. During this closure, we have 3 tiers of educational services that we can provide whenever students are out. The first tier is quite simply the school-based tier, things that we would call homework on a regular school day. So opportunities for learning that teachers have easy access to in their classrooms. Our terrific libraries, ensuring that our students have access to those libraries to continue the learning process while they're out for these 6 days, because it's 6 total days that they're out of school for right now. If for some reason this continues, school closures continue, we'll move into a tier 2, which is multiple approach to educational services that will include traditional packets of information, research opportunities for our students, some technology use for our students, and utilizing things like our local television stations for educational services for our students who don't have access to things like internet in their home. So we'll be moving to that should the need arise in Tier 2. Our staff has been amazing at planning and communicating. Our parents have been wonderful to work with, and we just stand very proud to represent the Valley in some small way. The Medford School District, we take the health of our students, our staff, and our community very seriously. Thank you for your time today.
Dr. Shames, would you say that packages from China are still not at risk for people here in our community to worry about?
I understand that there is the possible risk of inanimate objects. I think a package going all the way from China is safe to open.
And as far as tests, how many tests do we actually have in Jackson County?
That's a really moving number. We have tests that are available at the state lab, and those tests are increasing, but we now do have private labs, LabCorp and Quest, for example, and they're gearing up every day. I don't know the numbers, but we are setting up testing opportunities around the community with the understanding that we will have access to private laboratory testing.
And kind of going off of that, we've been told by doctors that their requests to get people tested are being denied. How are people choosing who's getting tested?
Sure. So there are criteria for testing to make best use of the state tests that we have. And essentially we're focusing on the people that are quite ill, people that need to be hospitalized and have compatible symptoms, have a negative influenza test, et cetera. Those criteria are really rapidly changing now that we have access to the testing. And I would say there's some confusion because we're kind of putting the pieces of this together. I'm hoping by Monday for there to be a lot of clarification, both in terms of what are our recommendations and what's available.
How many tests have been done in Jackson County so far?
We don't have access to those numbers because now the authorization for testing is not totally in our hands. So I don't know the numbers.
For the state level testing, I know you said private testing you don't have the number for. Do you know for state level if we have those numbers for Jackson County?
The state has all of those numbers, so they're the one taking the lead in getting that info to you. So I do encourage you, for persons under monitoring and testing numbers, to access Oregon Health Authority.
What is a fever temperature that you would say a relatively healthy individual would want to go get care if they're displaying symptoms that are, dry cough, fever, what is the point where you would say this is when you should call a healthcare provider?
So we want to be careful we don't overwhelm our healthcare system. We want to be careful that we don't infect others with our illness when we leave the house. If you are doing well and you think you've got the capability of keeping yourself away from others and staying healthy, I think it's not a bad idea to plug into a healthcare provider and say, here's what's happening, here's what I'm planning to do. I wouldn't go out and get tested just because you're not feeling well. So I don't think there's really a criteria for that. We may have a different plan in place. So for example, in some countries, China and South Korea, very different cultures than ours, but they would take people with a fever and have them go to a central location, get diagnosed, get tested, get quarantined, what have you. So we may come up with a different strategy, but right now I think the safe thing to do is to stay at home and don't infect others and take care of yourself.
A lot of places around the country are opening up drive-through testing. Do you expect any of that to happen here in Southern Oregon at this time?
Yes.
I know we talked about this the other day at the last press conference, but you talked about flattening that curve.
Yes.
Can you, for someone who has no clue what that means, can you just explain the very basics and why that's important to do?
Sure. So if you look at the math, we talked about this R0 concept of infectivity. And the other piece I didn't mention is how long it takes from the moment you are exposed until you get sick. And on average, it looks like that's about 5 days for the coronavirus. And unfortunately, you may spread the virus for some period of time before you even know you're ill, and certainly when you're not terribly ill. So with that in mind, the numbers increase exponentially. So you've got one person sick, and then you got 3 people sick, and then you have 9 people sick, and then you have 64 people sick, and very quickly the numbers get very, very big. And that's why when you start mapping out what happened in Italy, for example, or Washington State, or New York for that matter, there weren't that many cases, and the next day there were a lot of cases, and the next day there were a huge number of cases, and you get in trouble really quickly. So some of these strategies of, shutting down the NCAA and the Major League Soccer and et cetera, and schools, when you look around, you say, we don't have that many cases. What we're trying to do is to flatten that curve, keep the number of cases manageable. So you can go to the doctor, you can expect that the ambulance will show up if you're really sick, that there will be ventilators for you in the ICU, rather than we're totally overwhelmed, it's chaos. So that's what we're trying to prevent.
Can you talk about the timeline? I know that, Governor Brown, obviously 4 weeks for school closures and more than 250 people gatherings. Why do you think that timeline, is there a reason for a month? Does that go along with what you're saying with the curve?
We can't predict the future. I'm sure the governor would extend that if she thought that was appropriate. I think it's reasonable to pick a timeline and say we'll reevaluate. I think what's not stated is we will really reevaluate when we get close to April 1st.
I have a question for the superintendent.
Sure.
So technically, teachers will not be working for 1 week because another week is spring break. Will they still be paid during that time period, or how is that going to work for the teachers and staff at the school district?
So the Medford School District is committed to our teachers and staff, and there won't be an employee held harmless because of a decision that's outside of their control. So in this case, teachers and staff will be paid for this upcoming week.
And is there a chance that this does spread more than a month? They will be working from home as well, and it won't be going to outside resources.
Yeah, well, the reality is, as Dr. Shames said, the fact we don't know what the future is going to hold. So there is a tier 3 option, which is like there's nobody in our schools, and we're somehow outsourcing that. That is the furthest out, most radical option that is out there. At this point, one thing we know for sure about COVID-19 is that it is an hour-to-hour, day-to-day affair. And so we're at Tier 1 now. Our schools are going to be closed for a period of time. During that time, we'll continue to monitor everything that's going on around the globe, and particularly in Jackson and Josephine counties. During that time, we will make a decision about what next steps look like.
And I just want to make sure I understand this. So for the next 2 weeks, next week the teachers will be paid, and then it's spring break.
Then spring break.
But for the next 2 weeks, there will be no one in the schools.
That's correct. That as it stands right now, there will be no school staff in the schools. The question we don't have an answer to is, will we be allowed to run a day camp or have an outside provider provide places for our particularly frontline workers to bring their kids? One of the things we know, one of the reasons that we were holding with our schools open is because we know, for example, healthcare workers are needed, and we don't need healthcare workers wondering about where do our kids go. We also know, as was mentioned earlier, that oftentimes our kids, when schools aren't open, they go stay with an adult who is a little bit older, who we know is more susceptible to this. And so with the closures, we're not sure where that's going to land. We again are waiting for ODE to make some decisions and give us some guidance about how that can be used. One of the things we are committed to, though, is that we have school-based clinics. And as long as the staff is there for those school-based clinics, we do not want to stand in the way of people's access to health care. So we're going to do everything in our power to ensure that those community-based clinics stay open for the people who need them. And so we're working with La Clinica and other folks to make sure that happens. I also want to give a real quick shout out to the fact that the best place to find the most up-to-date information in the Medford School District is our website. This is an ongoing affair, and we continue to update that website all the time. And so parents, if you're out there, please pay attention to the website. It'll have a lot more details than I can provide today.
Have you had any internal policies instated to sort of talk to the kids about what's happening? Have you instructed teachers to let them know? How's that working?
Yeah, one of the things, I just met with some teachers recently, and we had the conversation about what are kids' reactions to this? Because the reality is, I have found that being honest with children, developmentally appropriately honest with children, really helps them understand their fears and allays some of their fears, because then they have agency to make some choices on their own. And so we have talked a lot about hand washing and using hand sanitizer and sneezing into your elbow. That is an ongoing bit of conversation. Because of the timing of this, individual teachers have taken some work that they found. CDC has put out some great resources for our students, and have been able to talk to students about the fact that things like what we heard today, that the least likely affected people for COVID-19 are those human beings under the age of 10. And literally I had a teacher say to her class yesterday, y'all are the luckiest crowd because you're the least likely to get infected by this. And so absolutely working with kids. One of the things we put in our communication and we have on our website is, how do I talk to my kids, my own personal kids, about COVID-19 and what's going on? And so those resources are on our website as well to help parents know how to navigate these tricky waters that we're in.
Does this mean there will be an extra week of school at the end of the year, or is that still undetermined?
We don't know. ODE is not sure how that's all going to play out. We certainly will work with our families and communicate that out very well once we have a better idea. Another question that comes up regularly is, what about graduation and prom? Because those are very big things. And the reality is, right now, those are scheduled outside the window of April 1st, April 8th. And so at this point, everything is still on, and it's a day-to-day and hour-to-hour event, and so we continue to monitor everything to ensure that our students, our staff, and our community as well.
Can you elaborate any more on the deep cleaning and what that would entail, or do you guys know those details yet?
Actually, absolutely, because we've been involved in deep cleaning forever. Schools are very clean spaces. Our custodians do great work every night to ensure that our schools are safe for our kids. But I'm going to invite Ron Havner, who is our Director of Facilities, up. Ron has led this department and can give some details about what deep cleaning actually means. Ron?
Yeah, I mean, like Dr. Champion said, we deep clean these schools on a daily basis already, but really there's a hidden opportunity in the break for us because we can get into the spaces freely and get into classrooms, hit the high contact surfaces more frequently. We can kind of mass our day-to-day staff with some of our sub-custodians and get more people in there. So I would say we're probably going to focus in the classrooms a little bit more, get more people in the schools, and then we'll use some of that equipment like our electrostatic sprayers and things like that to decontaminate or sanitize the sites in mass.
Now, what are you wearing when you do this really deep cleaning with how contagious this virus is?
We don't wear anything additional. It's not recommended that we wear masks or anything like that unless you're infected, and if you're infected, you're not in the school. So for us, we just wear our normal work clothes, and the product we use and the equipment we use, we can do it while the kids are in school. So.
Any other questions?
I have one for the superintendent.
Yeah.
Can you talk a little bit about morale and what that's like with students and teachers right now?
Yeah, I'm happy to talk about that. So we recently sat down with the leadership of our outstanding Medford Education Association, MEA, and had a wonderful meeting with them. And the morale was such that they said, "What can we do to help?" Matter of fact, the last night before the governor made the announcement that schools were closing, the leader of MEA reached out to me and said, "MEA stands prepared to do anything we can do to ensure that our students and staff are safe." So what is it that we can do? That is a great indicator of very strong morale in our school system right now. I can tell you that the staff in the Medford School District is fantastic, dedicated to students, and it just really shows in moments like this. The other group I want to give a particular shout out to is our school leadership. Our school principals have been at the forefront of taking in all the concerns from students, from staff, and from parents, and have done a terrific job of ensuring that high-quality communication is provided to everyone, that everyone stays calm, and that we ensure that everybody's safety and security is taken care of.
The food programs, you mentioned stay tuned on that. How much longer before you know about that? And also, how if the buildings are closed, how's that going to work?
Right. Well, great question. And honestly, because we had no guidance from Oregon Department of Education, we just started moving on it, to be quite frank. And so our goal is to start providing meals on Monday. Honestly, they may be sack lunches whenever the first ones roll out. That's kind of curbside service. You come in, pick up your bags, and go. The other thing we are looking at is how can we provide some hot meals and ensure social distancing is part of the drill whenever we were to offer those kinds of hot meals. Our staff is working on that right now. There also are opportunities for things like we have some incredible faith-based organizations and churches who have provided backpacks full of food for some of our kids who don't have regular food during the weekends. That program continues as well. So we are trying to do multi-touches in multiple ways to ensure that kids are well fed during this time.
I have a question from somebody here on the live stream. They wanted to know if kids are still allowed to play on the playground even though the school is closed.
Yeah, absolutely. One of some of the guidance that we have received from CDC, and so it's our understanding, and so Dr. Shames, if I say something wrong, please correct me, is that outdoor things, when there's not a large gathering of human beings, that's a good thing, in fact. However, people should still practice good hygiene. Hand sanitizer should be readily available, and since schools aren't open, we're not able to provide that during that time. So I would encourage parents, if they're coming out there, to make sure that they have Kleenexes, they have hand sanitizer, and they're able to use that after they use the playground. Does that resonate with you? Excellent. I got the head nod from Dr. Shames, everyone.
How about state assessments and the SAT testing that's coming up?
It's a great question. One of the things we're also committed to is ensuring that our students' futures aren't negatively impacted by this decision. And so our top tier of working with students are our seniors who are currently getting ready to graduate. We don't want to do anything that impacts their ability to graduate from school. And so we're working to ensure that they get the credits that they need. The reality of SAT testing, there's there's a test this Saturday, and so we are ensuring proper social distancing for that test. And again, that's an exam that helps determine kids' futures, and so we're making sure we practice all the best practices we can, and we're allowing those kids to take the test. Schools are technically closed until Monday, and so we are absolutely using our building to have that SAT test.
Governor Brown, she mentioned when she was explaining the reasoning behind the closure that staffing was the main reason. What were the schools like here? Do you know?
I can tell you the Medford School District has an amazing staff who were here, they were present, they were taking care of kids. Staffing issues were not a problem in the Medford School District.
Any other questions?
A couple more for Dr. Shames. With the people who were in quarantine here in Jackson County for the 2 cases, how long will they continue to be in quarantine for, and how are they doing? What's their current status?
Do you want to try and answer that one? So the reason that's a difficult question is because it's 14 days from the point of contact. If they have no symptoms, they're then released from quarantine. And, our initial push to identify people with foreign travel, et cetera, that's really kind of shifted, and that's less of an emphasis for us at this point. But, when there are individuals who are being quarantined or being monitored by us, we have daily contact with them. They're taking their temperature. We're following pretty closely. Everything's going very smoothly.
So are they still in quarantine then?
So I think her question was actually about our 2 presumptive cases that are isolated. So when we use the term quarantine, those are people who we've identified have a risk, but they have no symptoms. We use the term isolation when someone we're telling them to stay at home because they are sick. So I think your question is, how long do the 2 presumptive cases that are in isolation, how long do they have to stay there?
Yes.
Right. The guidelines on that are evolving, but generally when somebody is afebrile and their symptoms have markedly resolved and they are beyond at least 7 days from the onset of symptoms, they're generally considered able to leave isolation and go out in the community. So I'm really not exactly sure where the status is on these folks. So I don't really know whether they fulfill those criteria or not. But they've been very cooperative, and when they finally get out into the world, they'll be safe.
And as far as people, you explained the difference between isolation and quarantine, people who you have asked to quarantine at this point, how many, do you have a number, an estimate in the county?
We're not releasing that number because we're a small community and those folks could be identifiable. We're just, we're releasing those numbers on a more aggregate scale. Okay.
Any other questions?
Superintendent, I have a quick question.
Sure.
Yeah. Well, you mentioned the different possibilities for, say, if kids end up staying home longer, education.
Yep.
I think you mentioned one of them was TV.
Yes.
Local TV.
Exactly.
What's
yes.
that?
So, well, it's a great point. So I have TV cameras right here in front, and so one of the things that we would do in that instance, we actually Natalie Hurd, our outstanding media coordinator, and many other things, is we'll be reaching out to our local stations and asking if there would be a time when we could actually use local broadcasting to broadcast some educational stuff for our students, and something a little more educationally strong than stuff. So educational resources, having the opportunity to share with students some opportunities for research and things to do. We don't know how we could use that time. What we're trying to do is figure out these multiple touches for our students. And how do we bring an equity lens into the fact that some of our students have access to the internet at home, and we want to use that absolutely, and some of our students don't. However, with an antenna, lots of our students have access to our local stations. And so what would that look like, and how might we partner with one of our media companies in order to do that?
CBS has some March Madness slots, I heard.
We could be in prime time.
Now that basketball's gone, we're open to Saturday.
Yeah, perfect.
During her statement,
guys.
she said the early learning division will support childcare programs and will work to identify resources to support childcare needs. Will support. Do you know what she meant by will support? Is she
I
talking
do
about-
not. I will say that the entirety of the guidance from the state of Oregon at this time is what you have in your hands. And so we are unsure exactly what support means, we're unsure what closing means, and we're hoping to get some clarification from the state pretty quick.
Okay, any other questions? All right, thank you guys for coming.
Thanks, guys.
Thanks.
Anyway, seriously.